Hello everyone. If peptic ulcer is suspected, what should we do next? Now we will introduce examinations for diagnosis. The most typical way for ulcers to be diagnosed is by a procedure called an EGD. EGD stands for esophageal gastroduodenoscopy. Ulcers identified during a EGD may be photographed, biopsied, and even treated if bleeding is present. There are two kinds of endoscopy: traditional endoscopy and magnetic capsule endoscopy. Traditional endoscopy is cheap, but some patients cannot tolerate. Magnetic capsule endoscopy is painless and safe, but expensive. So the endoscopy we talked about today refers to traditional endoscopy. Endoscopy is required for patients with alarming symptoms, such as irregular abdominal pain, weight loss, anemia, vomiting, and hematemesis or melena. The gastric ulcers are staged by using the endoscopic staging system into 3 stages as follows. It includes the active stage, short for A, the healing stage, short for H, and the scar stage, short for S. Active stage can be divided into A1 and A2. In A1 stage, ulcer center covered with white fur, the surrounding mucosa is swollen, and no regenerating epithelium is seen. In A2 stage, the surrounding edema had decreased. The ulcer margin is clear, and a slight amount of regenerating epithelium is seen in the ulcer margin. A red halo in the marginal zone had a white slot circle in the ulcer margin are frequently seen. Healing stage can be divided into H1 and H2. In H1 stage, the white coating is becoming thin and the regenerating epithelium is extending to the ulcer base. The gradient between the ulcer margin and the ulcer floor is becoming flat. The ulcer crater is still evident and the margin of the ulcer is sharp. In A2 stage, the defect is smaller than in H1, and the regenerating epithelium covers most of the ulcer floor. The area of white coat is about 1/4 to 1/3 that of A1. Scarring stage can be divided into S1 and S2. In S1 stage, the regenerating epithelium completely covers the floor of ulcer. The white coating has disappeared. Initially, the regenerating region is markedly red. Upon close observation, many capillaries can be seen. This is called red scar. In S2 stage, the redness is reduced to the color of the surrounding mucosa. This is called white scar. Another way ulcers were diagnosed in the past was with an X-ray test called an upper GI series. An upper GI series involves drinking a white chalky substance called barium, and then taking a number of X-rays to look at the lining of the stomach. Doctors can be seen the ulcer on the X-ray when they have barium in them. An upper GI series are less expensive. It is difficult to analyze and less sensitive and accurate in diagnosis of small ulcers. It is unable to obtain a biopsy to rule out malignancy. Tests for HP are now widely used to detect HP bacteria in the digestive tract, diagnose the infection, and to evaluate whether treatment has cured the infection. There are several different types of HP testing that can be performed. 13-carbon urobrase test is the best first-line test. Stool antigen test sensitivity and specificity approximately reach to 95%. Serology as sensitivity is about 95%, specificity is only 85%, and it cannot confirm eradication visit and persistent response. Endoscopy and biopsy with rapid urease test is routinely performed at endoscopy. Fecal occult blood test is needed to determine whether or not combined with bleeding. OB positive refers to the amount of bleeding as 5 to 10 milliliters per day. That's all for examination. Thank you for listening. See you.